grew up here in Orono. Actually went to Notre Dame for undergrad, and that's where I met my wife. And then we both went to Arizona together for dental school. I went and did my residency at orthodontics back here in Minnesota, and then she followed 2 years after that and did her residency, and then kind of put each other through school, and then now we're working, so it works out pretty good. We've all sort of done a little different things. My dad didn't practice with his dad, but moved up here, and then when I bought my dad's practice, we worked in different offices, and then we bought 3 or 4 more offices on top of that. So it's been kind of fun to we started with the same profession, and we've kind of sort of branched off on our own and done a little bit different things, but it's been really great. Really enjoyed it. Been very blessed to have a lot of family in a profession that I love to do. It's a family business for us, as far as, not just because, we're third generation, but also we treat everybody in our practice like family. We treat all of our patients like family. I always treatment plan all of my patients with, what would I do for my kid? And we try to customize all of our treatment plans based on what we would do for someone else, a very empathetic practice. And I think the other side of it too is we're, very technologically ahead of the curve, I think, in a lot of ways. We've been doing Invisalign longer than about anybody else. We're getting into some of the 3D printing stuff. Some of the, we do a lot of lasers, cone beam, all of that, and that kind of gives us a little bit of an edge as far as diagnostically getting cases treated a little bit faster.
I get a complicated case, once a week maybe, where I say, hey guys, what do you think? Should we? And it's nice because then we always have ideas that we can bounce off each other. Even though we all went to the same program, all 4 of us all went to the University of Minnesota for a residency, we all still treat things just a little differently. And so, one will be like, yeah, I'd consider, expansion first and then whatever. So it's nice to be able to get different perspectives, even if we have similar mindsets at the end. It's good to have, ideas bounce off each other just to make sure we're doing the right thing for our patients too. So we found that studies show this too, where if you're seen by the same orthodontist for the most part throughout treatment tends to go a lot quicker. There's a lot less confusion on what's going on, and it just tends to go smoother. So we always let our patients, like if they need to come in on a Thursday, of course they can see Dr. Scott or Dr. Bill or whoever wants to see them. So we try to be flexible with our patients, but all else being equal, we want to keep the same patient with the same doctor throughout the treatment, so they get to know us and we get to know them, and it just makes it a little bit easier for everybody.